Mm. Nisha, can I start?
Yeah, sir, we can start.
Okay. Say, good evening. I'm Shambunathan. I'm one of the volunteers for this NIMHANS. So, as a volunteer, one of the functions that I perform is to moderate and introduce the speakers, resource persons for this kind of webinars in English webinars, which, as you know, are being conducted on alternate Mondays. But nowadays it is being held only on once in a month. But probably we'll go back to that. So, with this brief introduction, I will try to introduce the resource person of this today's evening. Namaste, Namaste and good evening, Dr. Rahul, resource person of this evening. Mrs. Nisha and Jyoti from NIMHANS, who are providing online and offline support for conducting the webinar. Dr. P.T. Shivakumar, Head of Geriatric Psychiatry Department of NIMHANS, and his team of doctors who are responsible for starting and providing support for these webinars, the enthusiastic and inquisitive viewers and participants of this webinar from across the country. I welcome you to yet another edition of this webinar being organized by VMS, an outreach arm of Geriatric Department of NIMHANS, Bangalore. I am happy to welcome and introduce. I am happy to welcome and introduce to you Dr. Rahul, resource person of this evening. Dr. Rahul is young, highly educated and experienced doctor, especially in the treatment of geriatric dimension. Highly educated and experienced doctor, especially in the treatment of geriatric patients with dementia, depression, psychosis, etc. After finishing his MBBS degree from King George's Medical University, Lucknow, shortly known as KGMU, in the year 2017, he has moved over to NIMHANS, Bangalore, and obtained his MD in psychiatry in the year 2021. He has also completed his postdoctoral fellowship from NIMHANS in the year 2022 in consultation liaison psychiatry, a department considered to be a very difficult one, because it deals with psychiatric issues in patients with medical or surgical issues like cancer, HIV, TB, diabetes, hypertension, etc. Dr. Rahul is presently working as a senior resident in NIMHANS. We are fortunate today to hear and benefit from his knowledge and experience in diverse fields such as dementia, depression, psychosis, etc. As a time management tool, I request participants to ask the questions, if any, in the chat box for him to answer. You may also raise your doubts after the resource person finishes his presentation. Yes, Dr. Rahulji, we thank you for sparing your time. As far as we are concerned, we are a set of senior adults trying to understand the various medical issues concerning this population, so that we become aware of them from resource persons like you who are experts in the field. Our objective is also to learn from you the methods of avoiding serious mental illness. Yes, doctor, the floor is now open to you. Please go ahead with your presentation. Thank you, doctor.
Thank you, sir. It was one of the most nicest and flattering introduction I've had for a long while. I'll try my best to try to give the information for which I have been asked to, considering all the enthusiasm of all the participants here. I'll try to share my screen.
Please go ahead. Please go.
So is this visible?
Yes, doctor, it is. But you can make it a bigger one.
Yes, that's it.
This is fine, doctor. Excellent.
Okay. So today's topic, as already shared with everyone, it's about when somebody feels low in life, doesn't feel like continuing life. So we want to talk about this this feeling which we get in the highlight of recent Suicide Prevention Day, which was celebrated yesterday. And we have had this topic for today's presentation. So talking about this topic, I thought like we should start with an interactive session. I will just put a link in the Zoom chat. Just see if everyone is able to click on that. Just type anything so that I can see that everyone can interact with the presentation as it goes on. So just click on that link and just say hello or just a good afternoon, good evening, a small hello from whoever can open the link. If anyone can see, we'll try to make this presentation a little bit more interactive. It's about talking about suicide, so I thought like I'll try to involve as many people as possible.
That is very nice of you, doctor. Yes, we will definitely, I mean, our participants will definitely respond, doctor.
So you can just click on that and submit your response. So it shows, so somebody has written hello, I think. So you can type anything. I think if you click on that link, it opens a browser and it gives a space for a response. So you can type anything. And then I just want to acclimatize everyone with what we are trying to do today. Just have an interactive session. We can wait for 1-2 minutes so you get used to it. You basically click on the link, a browser opens.
On which link, please, doctor?
In the chat, I have shared one link.
Hello, everyone. I come.
Yeah.
I
No,
click
sir.
on the chat?
No, so you should not click on that, sir. You should go to the higher one. Join web polev.com. So, see, I mean, at the top, you see that join web.
Join by web, it is there.
Join by web, polev.com.
Yeah, polev.com.
Yeah, text send.
On that,
Yeah, on that you will have to click.
but I am not.
If you click, I mean, you are getting hello.
Hello, everyone, I got.
Yeah.
Yes, in that response, there is a space for a response. You can enter your response in that, sir.
Response.
So you can enter a response and then you can just submit the response. So it shows up here. So I would request that everyone can. Just type anything which you feel is an appropriate response and then you can submit it. So few people have submitted hi, they have submitted hello.
Hi, I submitted now.
Yes. So it has come, so the more number of responses we get, the more that word becomes more bigger and bigger. So hi, few people have written hi, so it is kind of becoming a word cloud. So I hope everyone gets to, so there are already 4, 5, 6 responses. Everybody understands this because as we go into the presentation today, we will have few utilization of this process. So the link will stay the same. You can go into the link whenever we come to a slide where we need to interact. We will come back to the slide. Okay. So with that, we'll begin the presentation today. And so first of all, just with the, maybe we can unmute or type in the chat. If anyone can tell who are these personalities, famous personalities? Do we know them? Does anyone know if there are any works or anything?
This is one, the center is one actress.
Yes, sir.
And I think she committed suicide.
Yes, sir. Yes, sir.
Right?
So she's Marilyn Monroe. She was a famous actress.
Yeah, my famous actress. She died by committing suicide.
Yes. So Musfina has also, Musfina ma'am has also mentioned that Sushant Singh Rajput, he was a former actor.
Exactly.
And he also passed by committing suicide. And on the right side, we have Robin Williams. He was a famous comedian actor. And so the commonality which pertains to our topic today is also related to this, that we have seen in past, we have seen in famous personalities, people committing suicide. We have seen it in common population also. We get frequent news talking about suicides in students, in farmers, in certain people who have undergone a lot of stresses or recent events, doctors. So this is common parlance for us. We have heard about this news in our day-to-day life one or the other time. So understanding about the magnitude of this thing, which is happening, the NCRB, the National Crime Report Bureau, had put up a report in 2022. So it had said, it tried to give us a rough data on how frequent or how big this, if to say an epidemic of this is happening in India. So the NCRB report in India published around 2022 reported a suicide rate of around 12 per lakh population in India. It reported an ratio of male 72.5 to 27 female, almost 2/3 males and 1/3 female. So this, we are talking about completed suicide, people who have completed suicide, not just suicide attempters and who survived, but people who have committed suicide. The age group from 18 to less than 30 and from 30 to 45 were accounted as the most most common group of people who were committing suicide. Around 35% who have committed suicide belong to 18 to 30 years of age, and 31% belong to 30 to 45 years of age. So we can see that early adulthood and middle-aged people are the most common group of people which have been found to commit suicide. 64% of the victims were reported to have an annual income of less than 1 lakh. So a financial issue or a financial stressor seems to be a very common correlated stressor or event with the people who are committing suicide. And then they have also reported that hanging and consuming poison were the most common means. So this was our NCRB report in 2022, which highlighted the key factors in what type of parameters we are seeing in our population who are committing suicide. So coming to the audience members, the participants today, I would just want your what your opinions holds, that what could be the most common reasons do you think that people commit suicide? Again, that link, you can click onto it and then you can type whatever response you feel is what do you think is the common reasons that people try to commit suicide. So if you click on that link, this question will be coming and you'll again be having that same enter a response, and then you can submit your response into that. So that same link which I had shared in the chat, you can click that and then this opens, the box opens. The question is same in the link, that what could be the reasons. And
Doctor, I'm trying to do that. I'm not, the box is not opening.
you can refresh the page, sir. You can refresh the page, or you can click again on the link. So people have shared a few relationship issues, family related issues, some feelings, social circle. Somebody has tried to read lack of social circle, most probably they have written. So feelings, their mood, fairly common reasons. What else people think? People can write in the chat also. So somebody from who has logged in has replied that loneliness, that again the lack of social support or social connection is a very common reason.
Doctor, you would write frustration.
Frustration
with life.
Definitely. Financial issues, a very important one. Financial issues.
Health issues also, doctor.
Health issues, health and medical complications,
Health
very serious.
And financial issues to tackle that.
Definitely. So somebody has written mental disorders, which is again a very huge reason for people, which is very commonly seen in people. So I think we fairly get a point. We understand what are the common reasons for suicide. Moving on, let's see what the NCRB report found out. So what were the most common reasons? So this was the data which the NCRB report provided for the year 2021. So they said that maximum people who committed suicide, history-wise, they had family problems. 33% had family problems in their life. Second, as Jambunathan sir was telling, illness, medical illness, psychiatric illness was 18% in that. Other causes were alcoholic use, drug use, marriage-related issues, relationship or love affairs, bankruptcy or indebtedness was one of the common reasons. Unemployment, some work-related problems can be there, professional or career-wise. Death of a dear person. So 1% of the population said that death of a dear person was reason which led to the suicide. Then poverty, property disputes, failure in examination, fall in social reputation, some suspected or illicit relationships, impotency and infertility in 0.2%, and some other causes were there, and in 9.7% they could not identify the causes. So we can see what are like different types of stressors are there, different type of reasons are there, which lead to suicide. And it's not one thing which we can focus. Some people might have 2 or 3 reasons. There might be different causes which lead to suicide in them. So coming to understand that who are the people who are at more risk, who would you say that they might have higher risk of committing suicide? So if some person is there who has committed prior suicide attempt, who has attempted a suicide before, that is at a very high risk. If there is history of depression, if there is history of other psychiatric illnesses, psychosis, bipolar, depression, and anxiety, these lead to higher risk of suicide. If there is a chronic physical illness, chronic pain, cancer, HIV, these also lead to higher risk of suicide. There are stressful life events. It can be financial, it can be relationship related, work related. These increase the risk of suicide. People who are more impulsive, have more high aggressive tendencies, tend to be at higher risk. People who use substances like alcohol, drugs, alcohol or opioids, cannabis, at higher risk of suicide. If there are past history or current history of childhood adverse events, what does childhood adverse experiences mean? Basically, bullying is there, trauma is there in childhood, loss of family member is there in childhood. Those people are at higher risk for suicide. And very importantly, people who develop a sense of hopelessness, feeling that their future is not going to be any better, it's going to get worse, it's going to remain very dull, there is no hope in their future, those people are also at high risk for suicide. So these are the people whom we have to be more vigilant about, more careful about when we talk to them, when we see them, because these are at a higher risk than the general population. So at the general population rate, we saw that it was 12 per lakh in the general population. So these people may have very high risk, 5 times, 10 times than the general population, depending on the risk factors. So as there are risk factors, there are some protective factors also. So protective factors can be that there is support from partners, support from family members, support from friends. These are protective factors. If there is a reduced access to lethal means of suicide, there is reduced access to pesticides, poisons, lethal arms, guns, these can reduce the people at risk, the risk of committing suicide. If there are strong cultural or religious beliefs which prevent or are against in their cultural or religious norms, the suicide is against their norms, that also forms a protective factor for the person. If the person has good coping skills, good problem solving skills, it seems to be a protective factor. And if there is a good access in the community to mental health professionals, mental health services, good connection with the community, to have adequate mental health treatment when needed, these have seemed to be good protective factors for people against suicide. So let's come to some myths, some facts about suicide. So I'll just present a statement. I want everyone to go to that link again. Just click on that link. Now the question will change. You will get options to choose from. So let's say the first option, the first statement is, I just want you to click on an option, say that if it is true, false, or do you think it could be either, you don't know, maybe. So the first statement, we're just talking about what does the audience feel, what does the participant feel today about this statement, that talking about suicide or asking someone if they feel suicidal will encourage their suicide attempts. Do you feel it is true? Do you feel it is false? You can just again go into that link, and then this time the question will change. So people have answered, one person has answered false. So 67%. Someone has answered true also. Two people have answered, I think, false. So same thing, you can go into your link again. I think it will show you an option. You can change your option based on that. Somebody has, I think, typed in the chat, says false.
False. Yeah.
So most of us agree that this is a myth. It was earlier considered, or there is a stigma around talking about suicide or people who have these death wishes, that if we talk to them or if we ask them, their likelihood of attempting a suicide will increase. So it is on the contrary, it has been shown that if you try to help, if you ask about the suicide, there is considerable chances the suicide attempt can get prevented, or at least the risk reduces. So coming to the second point, second statement, let's see. Yeah. So people who talk about suicide never attempt or die by suicide.
That is false.
Yeah. So definitely, yeah. People will have this belief that if somebody is talking about suicide, they are not going to attempt. They're trying to just maybe they say they're trying to seek attention. They are just expressing. They are not very serious about it. So these type of beliefs can be there. So I think most of the participants agree that this is again a false statement. So again, coming to the next one, once a person is intent on suicide, there is no way of stopping them. Basically, that if somebody has suicidal ideations, then it cannot be prevented, or it cannot be stopped, or the person is going to commit suicide or attempt suicide, and there is no way to help him. So yeah, again, most of the people here agree that this is also false. Suicide is, as to large extent, preventable if correct measures are given at correct time, if correct interventions are done at correct adequate time, promptly. So again, a false statement, myth which was prevalent earlier. As more and more stigma reduces, people have become more aware that there are methods to prevent suicide. There are methods to help people who have these thoughts. So some of the other common myths which are there: suicide attempts or deaths happen without warning. So people can believe that that there are usually no warning signs, and suddenly suicide will happen and we will not get to know. So that is again one of the myths, and that usually people who attempt suicide usually express to someone that they are feeling low, they are not feeling good, and they are feeling hopeless, and they are going through a lot. So these things we have to be at a lookout for. There are mostly warning signs which can be seen, and help can be provided. If a person attempts suicide and survives, they will never make a further attempt. So people tend to believe that somebody who has survived can get a sense of relief, or that he has survived, and then he should continue to live, and then he will get better on his own, and then he will not attempt again. So that is again a myth. As I had told earlier, person who has attempted suicide earlier is at a risk, very high risk, that he or she will again attempt. So somebody has survived does not necessarily mean that they will not make a further attempt. On the contrary, they should be we should be more vigilant with them. We should look after them more, that they are at higher risk to commit suicide again. People who threaten suicide are just seeking attention. So this is one where the feelings are just ignored or minimalized, that they are just talking, they are just saying about threatening about suicide. They don't want to do it, they are not going to do it, and they are just seeking attention, which is again false. And people who talk about suicide need to be taken seriously. Help should be provided at promptly or at correct time. People who commit suicide are mentally weak. So this is one myth which is which was at least very prevalent, that they are not able, they are not hard enough, or they are very emotionally soft. They are mentally weak, and that is the reason they try to commit suicide, which is again not true, as we have seen that there are risk factors. They could be having long standing illnesses, they could be having psychiatric illnesses, they could have multiple stressors in their life which make them prone to suicide. People who commit suicide, it's not a statement on their mental toughness or mental resilience. There are multiple factors which are beyond the control of the person, which lead them to commit suicide. All people with thoughts of suicide are depressed.
Doctor, can I just stop you for a minute?
Yes, sir. Yes, sir. Definitely.
See, Doctor, you say that people who commit suicide are not or mentally weak is not true. It's a myth. No, what
Yes.
exactly? Then I mean, see, if they are mentally strong, why should they go in for this step, Doctor?
Definitely a good question, sir. That's why I had kept this thing. So one thing is that there are many things which are not in control of the person. Even there are biological underpinnings or biological mechanisms which lead to strong negative cognition in your brain. So even if you are a very, let's say, a prideful person, very strong, resilient, good, hardworking, and you are good in problem solving, if there are certain biological changes in your thought processes, then you tend to go in the line of very strong negative cognitions of helplessness, hopelessness, which are not at all related to your mental toughness. So saying even people who have been very good throughout their life, very tough, have uh, gone through hard things, multiple stressful events, can develop suicidal ideations, can commit suicide, because at the time the brain goes into such a downward path, that which is not under the control, which is not under the control of their toughness, or which they can just control by thoughts, saying that no, I am very strong, I can control it. Yes, it helps if you are a tough person, if you are mentally resilient, you have good coping skills. Yes, definitely it will help against the suicidal ideations, but the other factors are more stronger. Sometimes they are more stronger, which are not in the control of the person.
Thank you, Doctor. That helps.
Okay, sir. So coming to the next point, all people with thoughts of suicide are depressed. Not necessarily. So again, even depression is one of the most common psychiatric comorbidity which we see in patients who commit suicide, but not always, not all the patients are depressed. Some may have other medical illnesses, psychiatric illnesses, like psychosis can be there, like there can be substance use, drug use, alcohol use, impulsivity, lot of impulsivity can be there, which can lead to suicide attempts. The only effective intervention for suicide comes from professional psychotherapists with extensive experience in the area. So that is also not true at all. That only professionals can help patients, people with suicide. So that is not at all true. It all starts, as everybody was saying, that family support, friends support, support from partners, support from the community, social support, and then it goes to the professionals. Yes, if there are underlying psychiatric comorbidities, medical comorbidities, a physician, a psychiatric, a mental health professional can help in that, but the work can be done from anywhere. Help can come from any side to the person. So these were some of the common myths. Coming to the next topic, basically, what are some of the warning signs? How do we know that the person might be having some suicidal ideations or is at more risk more likely to attempt a suicide in the future. So some warning signs which we can look out, we can look at their talk, how they are talking, what is their mood, or how is their behavior. Is there any change in these three things? So how do they talk? Are they saying, have they expressed a lot of hopelessness? Have they expressed thoughts of killing them? Even have they expressed that there is unbearable pain, there is difficulty in any long-standing medical illness is there, and they are not finding it bearable to continue anymore? They are saying that they don't have any reason to live. They don't find any hope in the future. Mood-wise, do they feel more sad, or do they feel more angry than usual? Sudden anger, or they have expressed a loss of interest in their usual activities. They are not going for group activities. They are staying more isolated. They feel more humiliated somehow. They stay in more guilt, or are more anxious somehow. So any of these mood changes along with this talk, or if any of the change in behavior, are they withdrawing from activities? They are doing certain things very recklessly. They are not showing a care for themselves, their body, their surrounding. Do they have an increased use of alcohol or increased use of any drugs? They are sleeping too much, sleeping too less. Their appetite has increased too much or decreased too less. They are showing aggressive tendencies. They are isolating themselves from others, isolating themselves from friends. They are trying to complete their tasks or put an end to all the tasks, and trying to uh, finish all their pending tasks. So these type of behavior, or these type of mood changes or talk changes can give some warning signs to the lay person or a person in someone close to them. If they see these things, you can be little cautious if they have certain thoughts of feeling low, or trying to harm themselves. So we'll take the questions. You can type in chat. We'll take at the end of the session. We'll take all the questions. So how to help someone in crisis? So we have seen what are the risk factors, people who are at risk. How can we identify some signs, some warning signs that a person could be in distress, and could be having thoughts of harming himself. So how to help them? So first of all, we have to take there, if somebody expresses that they are in a crisis, they are feeling low, they want to they express death wishes or thoughts of harming themselves, we have to take them seriously. Even if you are unsure if they are serious or not, it's better to overreact than to dismiss their feelings. We have to listen actively and non-judgmentally. We have to encourage their person to talk about their feelings and thoughts without passing judgment. So we have to be non-judgment. We rather than guessing that what could be the cause, or this is leading to your thoughts and this is a trivial matter, we do not judge why the thoughts have come. We have to encourage the person to let them talk about their feelings, let them express themselves. Active listening basically means that you have to be present fully, show empathy, and do not interrupt them, or do not try to start giving advices. Just try to listen to the person, what they are trying to say, and understand what they are going through. Express empathy. Let the person know that you care and empathize with their pain. We can use phrases like, I'm here for you, and I'm so sorry that you're going through this. And we can ask directly about their intention. So this is one of the myths which we are talking about. You can directly ask them that if they are having thoughts of self-harming them, if they have thought previously of a plan for committing suicide. So this way you can understand or gauge the level of risk, and this should be done without a sense of judgment. You can ask them just to help them, and if they have something, you can ask. You can take the matters more seriously and provide extra help for such people. Avoid leaving them alone. If you feel the person is in immediate danger, they have a plan for suicide, we try not to leave them alone. Try to call their family members, contact others, and ensure that someone is there with them. Remove the access to lethal items, scissors, knives, firearms. Try to prevent that there such things are not there in the house. Always and always try to ensure that there is an access to a mental health professional, a therapist, or a counselor offered the person to help them find and contact one if needed. Try to arrange a meeting or an assessment with a mental health professional as early as possible. Seek help from others. It's no shame in seeking help from your family members, their friends, common friends, the person's family members, for any support or any other type of intervention. Be aware of emergency numbers which are available in your local areas, so that you can call. There are certain helplines, crisis helplines are there, which you can call, and the person can talk to usually there is a counselor or a counselor, lay counselor, or a mental health professional on the other side. You can talk to them, discuss what you are going through, which helps in quite a lot of cases. So these are some ways which we can help someone in crisis. What to do when you feel low? So suppose, let's say, what does the person who gets these thoughts try to do? So basically, if somebody tries to get these thoughts of harming themselves, the first and foremost thing is that they should try to reach out to someone, try to reach out to a family member, a close friend, loved one, anyone whom they can trust, can share their thoughts. Contact a mental health professional if these type of thoughts arise. Try to understand. A mental health professional can provide a lot of variety of treatment options that help in different matters, can understand the thought process from where these type of thoughts are coming. You can call a crisis helpline, which is available in the regional area, in the national level, which can immediately help you in resolving those type of thoughts. Keep yourself in a safe environment, again, away from some lethal objects. Keeping yourself in safe environment where you are not able to harm yourself. Avoid any alcohol or drugs during this time, because almost always under intoxication, the decision power, the inhibition goes away, and you're more likely to do something which your judgment is impaired, in which your judgment is impaired. Stay connected with the mental health professional. Once you have visited them, you try to stay connected with them, because it's not a one thing, it's a long process. When you start developing these type of thoughts, you have to be patient, you have to wait for some time till the help starts acting. And if you're taking any treatment, if you're going through any therapy or any process, group processes, it takes time, and you have to be patient in these things. The main thing is you have to stay in touch with whatever support you have tried to make around you. So getting help from mental health professionals, we can there are options of emergency care which are open 24/7, which help you get admitted. They start assessments and treatment on the emergency basis. People can come to the outpatient clinics where assessments are done in outpatient basis. Either you started on a psychotherapy, basically counseling sessions, specific cognitive related psychotherapy, cognitive behavioral therapy, dialectic therapy, these type of therapies which can directly assess what type of cognitive processes are going on which are leading to these thoughts. And weekly sessions or daily once in 2 or 3 days sessions can help significantly reduce these type of thoughts. Medications are a known effective treatment. Antidepressants have shown to be very effective in patients who have comorbid depressions, comorbid anxiety, and they show good response in 2 to 3 weeks time. For severe people who have severe multiple attempts are there, or multiple comorbidities are there, and the severity is high, inpatient hospitalization is there, where the treatment is more intensive. Assessments are more day-to-day basis. Careful observation is done to prevent attempts. certain stimulation techniques like ECT, electroconvulsive therapy, which has shown to be a very good effective treatment, are advised in certain cases. Crisis intervention helplines are there, wherein a lay health counselor, mental health professional, they try to help you over the phone and how to proceed forward. They try to put you in touch with mental health professionals. They try to contact your family members. These type of services are provided. Some supportive services are there, peer support, community-based support, community-based services, wherein case managers are allotted for home visits or to keep you in touch with the health services. In the end, the usual care is of long term, because this is something which can reoccur. Thoughts or ideas can relapse. So lot of awareness, education about it is required, that again, even if though it comes again, it is preventable, it is treatable. So a lot of education about it, a lot of awareness, a lot of lifestyle changes can help keep you active. Diet changes, exercises, yoga, mindfulness, these have shown to increase your endorphin levels, which seem to keep you in a better mood. And apart from that, adherence to your treatment, your therapy, your support services. So you continue those support groups or your treatment for a long term. So these are the things wherein a mental health professional or your treatment services can proceed. There are few helplines which are there in India, started by a few NGOs. So ASRA helpline is there, which works 24 hours, currently available in English and Hindi. And there is recently iCall helpline, which has been started by, I think, funding from the Tata Institute of Social, I think, college. So they try to help people who require emotional support. It is available in few languages, and the phone number is easily available in a single Google search. So these are helplines where you can talk to them. The anonymity is maintained, and you can share with them. They provide with you help whatever they can through the teleservices. So coming to the conclusion of this today's presentation, so basically clearing out some myths that suicide is a preventable emergency whenever comorbid psychiatric illnesses are concerned, recent stressors are concerned. Awareness about suicide or talking about suicide, breaking the stigma, can save lives. Connection, social support, community support is required to decrease the suicide load in the population. Access to mental health services, different type of services which are available, is definitely a protective factor, and people can benefit from it. Has shown to decrease suicide rates in the country. And there has to be a collective aim, not just from the person who has these type of thoughts. The aim, the burden lies on the society, in the community, as a nation or as a global group, as a whole, on the world, to provide a good community, a good social support to the people who develop these type of thoughts. So I think we can take some questions now. That was just the end of my seminar.
Thank you, Dr. It helps. See, you have almost covered all the aspects of this suicide. But one thing I would the viewers might also like to know is there any the family history of a person? I mean, supposing there has been a suicidal death in the earlier family history, does it automatically make the other persons in the family, suspected case, or well, how that helps? See, in diabetes, etc., we say that the family plays a role. The gene plays a role, to be very specific. Does it happen here also, doctor?
Yes, again, Jamunakan sir, very good question. Definitely, family history increases the risk of suicide in a person. So as you are very rightly giving the example of diabetes. So as we see in diabetes, let's say a person's both parents have diabetes. So it is not necessary that the person will get diabetes, but the risk of him getting diabetes will increase, maybe by 50%, 60%. than a person who doesn't have parents with diabetes. So similar things, there are biological underpinnings. There are, they have seen in studies, large gene studies and cohort hereditary family studies, that people who family members have suicides in the family history have higher risk. So yes, there is a genetic underpinning. They have tried to understand that serotonin is one chemical whose gene is slightly related, which increases risk for suicide. But again, it's the genetic compatibility, how strong it is or how much we can relate to, is not very currently not studied as much as for diabetes, let's say cancer or other genetic illnesses. But yes, we have understood that if there is a family history of suicide, the risk increases. Not necessarily that they will commit suicide, but the people who they are at higher risk, we can say that.
They could have suicidal tendencies as such.
Yes, they are at more risk.
They are at more risk. So we need to be more careful with such people, and such people who are aware of that can take some preemptive action of being very careful about developing bad thoughts.
Yeah. Yes.
So
So
that's
they can be aware of other risk factors. If they have long-standing comorbid illness, if they have substance use, if they develop any psychiatric issue, depression, anxiety, they should be at the forefront, little bit more vigilant. They should treat it as and when they go.
Yes, doctor. That was the idea of my raising this question, so that people because people know that, and when they know that, they can be aware of it and they can take preventive action. And probably, doctor, you was talking about this exercises and mindfulness and yoga, etc. Can you just elaborate a little more, doctor?
Doctor?
Yes,
Okay.
sir. Yes, sir.
Let him answer this, sir. Then I'll come to you, sir. Thank sir. Thank sir. Doctor, please go ahead, doctor.
So yes, they have shown that lifestyle changes like good eating habits, regular exercise, yoga, meditation, practices like mindfulness have shown to increase endorphin levels. So they show that consistently doing these practices, lifestyle changes, improve mood as a whole for the period these things are practiced. So as such, directly, we don't know that if directly it reduces suicide, but yes, if your mood is a little better with these practices, it's well advised that you can practice them in your lifestyle or in your daily activities. So definitely it has shown to improve mood. Yes, some studies are little in the earlier stages, yes, but overall it has shown to improve endorphin levels, a little bit of mood, reduce anxiety as a whole.
Thank you, doctor. Thank you, sir. Sir, you can.
I am not interested. I have put a question in my chat box. The doctor can see.
Yes.
Family issues, particularly dowry harassment. We have come across so many cases in our service as a subdivisional magistrate. People are within 6 years after marriage, they are committing suicides. These issues can be solved within the family or by social welfare officer. This is social welfare. Even the RDO and other family members, they can avoid, as per my experiences, a lot of cases we have seen. Particularly on Friday, they will commit suicides. And Saturday, Sunday, we have to conduct inquest and inquiry with the Deputy Superintendent of Police is the FIR. He has to write FIR and he has to send express FIR. And these things are happening, dowry harassment and other family harassment, physical harassment like this. This you have singled out one subject, family issues like that. Have you come across such things, sir? That's my question.
Yes, sir. Very rightly put, sir. As I was showing the NCRB report also, which is actually the police report of suicide. So they have shown that the most common cause is family-related issues in people who are committing suicide. And in women, the in-laws related issues, dowry related issues is the most common cause of committing suicide. So definitely it's a large cohort of people or it's a very prominent reason for people in women specifically who are committing suicide. Talking about how to go about solving this issue, I think it has to be again a collective approach. Family members, the person has to approach mental health counselors, social workers, psychiatrists, psychologists. So a family-based approach can be done. It's not about the person, just the person who is committing suicide or who is having these thoughts. It has to be a family-based approach, resolving the issues what are happening in the family, and then moving on forward how to address them. I don't think a single person can be assigned or can be blamed that this is because of you, this is happening, or you have to. Sometimes the women are said that no, you have to handle it. You have to handle it. This happens in all families or all with all the in-laws. You have to handle it. There has to be a reduction of this type of biases or stigma about it. And as a family, they have to approach some counselors, psychiatrists or psychologists or even social workers which can help resolve these issues.
Another things they are approaching for divorce, for intolerance, either go for suicide or for divorce. The increasing cases in the family court is increasing trend. Or suicide. The social activity, social responsibility. These things are social responsibility. They are inviting for marriages thousands of people, close relatives, friends, but they are not telling the harassment in-house to the close relatives or close friends to settle the issues.
Yes, sir, definitely, sir. So that's what happens in places where the person loses hope. They don't see any other outcome, so they look for divorce, they look for suicide. So the correct approach would be to go for a family assessment, family therapy first. I think the court also advises that they undergo therapy. People who are request for the divorce, they undergo therapy for a short period of time, or they say stay separated and see for a short duration as to how if things can be resolved by family therapy or couples therapy or counseling. If not, then decisions are taken at a later stage after a trial of therapy at least.
Okay, thank you.
There are few questions still. I think Dr. Srividya has mentioned that suicide attempt is punishable query legally. You think it is right to make? Dr. Srividya, yes, it was punishable earlier, but the 2017 Mental Health Act has changed the section on suicide attempt. So suicide attempt is no longer punishable crime. We have so the previous Mental Health Act was of 1983, I think 1983 or 1984, and so the recent Mental Health Act has changed this law that suicide attempt is punishable, addressing the same thing that suicide attempt happens in people who require help. So it should not be punished as a crime. So this has changed now.
Oh, that's a very good information, doctor, because most of us do not know that. We still think that, okay, the suicide attempt is punishable one.
Yeah.
And we still think that.
Next, I think.
Hello, sir. Hello.
Yes, sir. Yes, sir.
Ramnath. I was speaking Ramnath, sir.
Yeah, tell. Go ahead, man. Go ahead.
Yes. Generally, the senior citizens are not affected by suicide. Only a few percentage. So generally, why you are selling a senior persons, you are addressing senior persons generally, but they are not attempting suicide. Only for the disease, and they want only the mercy killing. They advise the doctors to mercy kill. That's all. Please explain, sir.
So, sir, it is not that senior citizens are not committing suicide. Yes, the rates decline from middle age, young age. It declines to elderly. But what they have seen is that serious citizens attempt less suicide, but they completed suicide, meaning that the person dies is more in elderly people. So the attempts are less and their completed suicides are more in elderly. If we see
Because
as a
of depressions, they advise inform the doctor, mercy kill me. That's all everybody is telling.
there are multiple factors, sir. There are multiple factors which are very prominent in elderly. I think few of the webinars would have discussed them. That social isolation happens. Their friends pass away. Their family members, some don't stay. Their financial goals, their life developmental goals that they had to do this, those get over. Retirement happens. So a lot of social isolation happens. Along with that, as Manjambunathan sir had earlier only told, that long-standing illnesses, they start to creep up on elderly people. Diabetes, hypertension, stroke, these are more prevalent in, again, elderly people. So these type of risk factors actually increase in elderly people, and there is actually a high rate of elderly population which try to commit suicide, sir.
Oh, thank you.
No, and in that, doctor also says that one thing, that the percentage of success in their attempts is very high.
Yes, sir.
As elderly people, Ramnath, the idea of this seminar is that as elderly people, we need to be aware of this.
Okay.
And when a person develops such a feeling, immediately take help. That is
Yes.
the intention.
In my
Correct.
family also, my father wanted about 86 at the time of 1 month after that, before that, they only ask you about doctor to mercy kill me. I don't want to trouble others. What they take. That's why. Okay.
Yes, sir.
So that option doesn't exist. It doesn't exist. So I think.
Thank you, sir.
Yes, I think, Ramnath, you are aware, I mean, you understand the idea of this seminar, isn't it?
Yes, okay. Thank you.
Yeah.
Thank you, sir.
Okay, fine, Ram.
Sir, few more questions. Dr. Sividya has asked that poor judgment by adolescents can be predicted by peers and not parents. How do parents help in such situations? So yes, sometimes in few situations it does happen that adolescents, children are more open, more close to their peers than the parents or teachers. So that was the thing which I was discussing in one of the slides, is that we have to be non-judgmental. We have to be empathetic toward the child, toward the adolescent. That is where a little bit of criticism or judgment comes from the parents sometimes, and the children or the adolescent feels not so open to discuss things with the parents. So these things, in these situations, maybe for the parents, one advice could be that to understand what the child is going through. Maybe a unit test may not be as serious for the parent, but very serious for the child. Maybe a scolding at the school by a teacher or a small bullying incident by the other students may not be as serious for the parent, but very serious for the child. So trying to understand, empathize with the child, trying to let them talk what they are feeling or what they understand is more serious for them, that can help, I think, bond the parents with the children and lead to more open discussions. Second question by Dr. Sividya again. In terminally ill or patients with degenerative disorder, what's the reports of suicides? Let's say terminally ill patients, patients who have cancer, patients who have heart failure or chronic kidney failure. Yes, the reports of suicide are quite high. It's mostly secondary to two things, that they develop comorbid depression. They develop something called as will to hasten death. They start having these wishes to end their life. The reports, I am not also very sure on the correct this, but I think at least 5 to 10 times the rates increase in these patients who are terminally ill, who have unbearable pain, physical dependency on other their families. They definitely have higher rates of suicide than the general population.
Yes, doctor, I understand. See, in fact, I mean, what is the, I mean, as a take home lesson, what is that you would like to say, doctor? See, I mean, once you come across somebody who is looking to commit a suicide or something like that, what is that as serious we can do?
I would say the theme of my presentation was that talk to them what they are saying, not just maybe you will be able to help, maybe you will not be able to help, but talk to them, just understand what they are going through, what they are saying, what their
For their mind.
experiences is.
For their mind.
Yes, what is on their mind, what is worrying them. Even talking to them, hearing them out, what they are saying helps quite a lot. And maybe if you are able to develop a good rapport, then you can lead them to treatment, to better options, and so on. So my takeaway would be talk to them and provide a social support whenever you can, where they can come and discuss their feelings.
Be non-judgmental. Very
Yes.
important is that we tend to become judgmental, doctor. See, we
Yes.
say that these are all things that I have also gone through, success also gone through, etc., etc. Instead of that, we listen to them and try to provide support for them. And the best thing is to take him to the best possible help center, where this person can be helped with his, the current status, so that he comes out of it. But
Yes.
have you come across cases where a person with suicidal tendencies has come out of that totally?
Yes, on almost on a day-to-day basis, we see patients who have suicidal impulses, who have death wishes, who have attempted suicide, and who improve quite a lot. They get back to they improve completely. They go back to their life. We are lucky to see patients who survive suicide attempts, come to seek treatment, or are brought by family members, and they improve completely in most of the cases, and they resume their life. So again, people who develop psychiatric issues, depression, psychosis, anxiety, or even because of long-standing illnesses, if they develop such thoughts, they tend to, when provided with support, when provided with treatment, counseling, they tend to improve quite a lot, sir. We almost see it on a day-to-day basis, sir.
Hello, sir. Excuse me. Ramnath here. Then again, that you can teach him that pranayama and meditation for 15-20 minutes daily. So naturally, it will come down. That thoughts. Isn't
Yes,
it?
sir. Yes, sir. Yoga has shown to be effective in improving mood, increasing concentration, and has shown to improve these things.
So,
Okay.
in addition to yoga, I think certain medical therapies are also needed, Ramnath. I think.
Yes, sir.
That
Yes,
is
sir.
Doctor was mentioning about serotonin level.
Yes, sir.
So, yeah, we need certain kind of medication. See, in fact, no doubt about that, pranayama or yoga helps. But in addition to that, yeah, it is to be decided by a professional. What
Yes.
is the person needs is to be decided by the person. But anyway, Doctor, that what you are giving is a very good news. That is, there is hope in the future.
Yes,
See,
sir.
most of occasions we used to get a feeling that we are in a hopeless situation, especially when I see this quota deaths. People committing suicide in Kota, Rajasthan, when they are trying to attend these courses, and getting an impression that I will not pass the test, therefore I will commit suicide or something like that. So, if you look at that, I think there needs to be some kind of a special attention to such centers, so that people understand all these things. Thanks, Doctor. It's a very beautiful the presentation, and I should also appreciate you, Doctor. You are never, very technical. You are down to the earth. See, we are all people. We are all non-medical people. Most of us are non-medical people, and we are trying to understand a very difficult, tough subject. See, normally we do not know that there is so much involved in a person committing suicide. So we have really understood what exactly is that? Why people try to commit suicide, and what is that we can do to support them so that they come away from that? And there is, from your speech, it is very clear that there is good, hope in the future. Once, once we are able to establish that hope in the future, I think most of these deaths will come down, doctor. And we should see a situation where this 12 becomes at least 5 or 6 in the next decade, doctor. That would be one of the successes for young professionals like you, doctor.
Yes, definitely, sir. I'm very glad that everyone was able to understand the topic. I try to keep it simple, and definitely, yes, that is the takeaway, that there is hope, and there is hope for treatment. There is hope for improvement, and that's what we try to convey to anyone who comes to us.
Okay, thank you, sir. You have conveyed very explicitly and expressly detailed. Thank you.
Thank you, sir.
Nisha, so if there is any other question,
Yeah, sir.
yeah, Nisha, please find out whether the people have got any other question.
No, sir. No.
No other question. So can we formally end it?
Yeah, sure.
So, doctor, thank you very much, doctor.
Thank you, sir.
For sparing your time and talking to people like us in a very, very, non-judgmental way. Because I should say that we have decided that we need to be taught this, and in that angle, you have not taken any technical word or things like that. The patients are, not normally like a doctor. So therefore, you have spoken to us at our level. We thank you very much for your time, your patience, and and we are amazed at your knowledge, doctor, and your ability to infuse faith in us, faith in the future, your ability to increase hope in the future. That is a very important part of it, doctor. Thank you very much, doctor.
Thank you, sir. It was a very wonderful experience for me. A very knowledgeable audience, I must say. Very good questions, very interactive. I just had quite a good session just talking with you all, and hopefully give you some information and some knowledge.
Thank you. No, not some information. They have provided us lots of information. In fact, I should thank you. And in return, we can only pray for you and your family. And we wish all the very best. And we pray God for your success, doctor. Thank you very much.
Thank you so much, sir.
Thank you for joining. Thank you, everyone.